Hi guys, my name's Bridget. I'm one of the exercise physiologists here at Vector Health. I have been asked the question, what is it that I like to do at my work? I'm pretty fortunate in the fact that my line of work means I see a really vast variety of patients, and so I can't really pinpoint my finger on one type of condition or injury yet so far that I found that I really enjoy. I have an extensive dance background, and so when I first started my degree, that was something that I was really passionate about. I did this degree because after 16 years of dance and training in my last year, hoping to go and audition to do my pre-professional years down in Melbourne or Sydney, I injured my back. And it wasn't until a couple of years after that, when I'd already detrained and didn't have that option to go anymore, that I realised how much something like, training in a gym setting and building strength and all the important parts of programming and prescribing a perfect exercise regime was important in maybe preventing that injury from happening, or even allowing me to come back and then having come back after that injury and being able to go on and actually fulfill that goal of mine that I had when I was much younger. So when I started this degree, that was my mind. It was like, I want to help young dancers and either rehab their injuries or try and help them avoid the injury that I had. And so that they can fulfill their dreams and goals. So that's always something that I get really excited about, seeing a young dancer or even a young gymnast walking through the door and they want to give the gym stuff a go. I really get quite excited about that. As I said, I've worked with a vast variety of clients, and I found that doing post-operative rehab, so people working with, I've mostly worked with knees and hips so far, so doing people after they've done a sporting injury, like a meniscus or an ACL, a total hip replacement, total knee replacement, any of the ankle stuff as well I find quite interesting, so they're probably some highlights as well. If anything that I've said to you speaks to you and you'd really like to come and have a chat and see how I can help you, I'd absolutely love to. I think exercise has a really important role to play in dancing and higher level sport. Dancing is absolutely a sport, and also your rehabilitation and your post-operative rehabilitation. So if that speaks to you and you'd like to know more, I'd love to have a chat, and I hope to see you soon.